Also the London Assembly member for Ealing and Hillingdon since 2012, and he's chair of the GLA Health Committee. So he's going to give us a wider perspective of all this.
Great, thank you. First of all, it's really a pleasure to be here with you this evening, and to thank Steve and Julian for having the courage to organise this meeting and for commissioning this report from Dr. Steele and his colleagues. So thank you very much for that. And thank you very much to all the good people for turning up this evening, and for all the campaigners for Save Our Hospitals and Save Our Hammersmith and Fulham Charing Cross Hospital campaign. So thank you very much for all your hard work. The battle does carry on, and this is another step in that campaign. And also from the outset, let me thank all the NHS staff, the doctors, the nurses, the allied staff, who work hard in delivering services despite all the pressures on them. So thank you to all those people who work in the NHS. We couldn't do without the goodwill of you guys serving the NHS. The STP stands for Sustainability Transformation Plans. We all want the NHS to be sustainable. We all want the NHS to be the appropriate organisation to deliver healthcare in 2016. We all do want to have plans for the future. But the only problem with the STP plans put forward are that they're not sustainable. They are not sustainable. They're not transformational. And they're planned for failing. The reason they're not sustainable is for one simple reason. Enough funding isn't going into the NHS. The funding level now is the same as in the year 2000, when we had a Labour government who was catching up on the years of failure of the Tory government before that. The investment in the NHS currently is about 8.5%. And when you compare this with France at 10.9% of GDP, Germany 11.1%, and Netherlands 11.1%. We have simply not invested enough money in the NHS. Since 2010, the population of this country has gone up by 2.5 million. Every year we expect the population of this country to go up by 440,000 people a year for the next 10 years. So we simply have got a service which is underfunded and is not sustainable. So who's driving this? STPs. Is it the doctors? Is it the CCGs? I tell you who's driving it. It's the British Treasury who's driving it. And whenever I ask a question to the Department of Health or CCGs, we're told it's security driven. Recently, a BMA survey was taking place in London, which showed that of all the GP surveyed in London, 67% hadn't heard of STPs. 87% had had no consultation on STPs. And 76% of them felt that they couldn't influence the CCGs. So I think the CCGs are out of touch with the membership. The GP on the ground aren't consulted, they haven't been consulted at all, and these plans aren't led by commissions, they're led by a bunch of Treasury experts driven by the political masters. That's what's driving this. And one of the most conservative organisations we have in sort of small c is the King's Fund. They very rarely speak up against the government. They always give courtesy support to the government. But let me just give you a quote recently from Chris Hand, who is the director of the King's Fund. He basically said that NHS leaders have never felt this target was credible and are now wondering when the Emperor will be seen to have no clothes. Many feel as if they are being seen living in a parallel universe in which they are striving to sustain existing services in conditions of adversity, while politicians promise improvement in the care that can be delivered and available resources. Simply that this STP plans are underfunding the NHS. And of course, we know the huge amount of pressures the NHS is under already. We've had 2 closures so far in North East London. The A&E closed in Central Middlesex and the A&E closed in Hammersmith. And directly as responsible for that, the worst performing hospital in North East London is Hillingdon Hospital. They can't sustain the pressures. We know, for example, the occupancy rate of beds in this country at this moment is 89.1%. Last time, the same year, same time, it was 87%. That's why the government had already said to the hospitals, shift some of the work away from the NHS hospitals into the private sector so they can plan for the winter crisis. We already have a poor performance in our hospitals. We used to have a winter crisis, now we have an all-year crisis. And the other thing that's out of the bottle is that the plans for STPs were hatched up in privacy since June. They only came to light because some of the councils, lucky councils of Ealing and Hammersmith and Fulham, had the courage to publish those plans. Otherwise, they'd be held in secrecy and they weren't meant to be seen by us. STPs have no statutory obligation as an organisation, and that's why the government thinks they can push those plans without consultation. But look, the real force in this country are the people of this country. As Bevan said, the NHS will survive as long as good people will continue to fight for it. You are the good people. The people of this country are the good people, and you people in this hall have the obligation, the responsibility to get the message across to the streets, get the message across to every household, to your neighbours, that these plans are unsustainable. We won't let our NHS go down the drain. This government only has one plans, and that's to change, is to ruin the NHS and take it out of our hands. We won't let it happen. And I congratulate all of you people this evening, and thank you very much for Ealing and Hammersmith for the fight you're doing for us. Thank you.